Hi, I am Dr. Colino and I'm here to share some tips based on my experience treating over 1,000 patients with the Carrier SLX 3D brackets. We will analyze a few cases treated with this system to help you understand best practices and achieve faster and more precise results for your patients. So, without any more delay, let's start. Compared to the current leading self-ligating brackets, SLX 3D is different in biomechanics as well as design. We've observed they move very quickly and precisely in detailing and finishing, and I've seen an overall reduction in treatment time. We've been able to achieve that by taking advantage of the system's key features. First, with different size brackets for each tooth using SLX 3D allows us to express the ideal three-dimensional movement in every tooth. Second, the precise slot will have the wire slightly over the clinical crown for very accurate and controlled root movement. And third, now the door is even wider and inclined so we can achieve the ideal torque and rotation expression. My team and I have tested SLX 3D extensively to leverage these features and establish a protocol. Here is what we learned. When we use the visual lines for placement correctly, the bracket will be in the center of the clinical crown. Precise positioning is key for precise results, and in my experience, every 1 millimeter of error here causes a 5 degrees change in inclination. The opening of the doors needs to follow the axis of insertion and bonding. Using the easy twist tool is the safest way to avoid doors being damaged. It's important not to use a tool for a different bracket on the SLX 3D brackets, as they can easily damage the doors. Last but not least, I've seen the M-Series arch wires retain 100% of their flex and thermal charge properties for up to 100 days. So, especially while achieving sagittal correction first, which I do using the Carrier Motion 3D appliance, most cases I treat with SLX 3D are successfully treated with a 3-wire sequence. Let's see how it works in practice. I've prepared 3 cases to show you how I place the brackets and plan the wire sequence to leverage the system's features. Let's start with Antonio. For him we needed to fix a functional issue. As you can see, he wasn't able to close his mouth properly. We decided to achieve a Super Class 1 first, using the Carrier Motion 3D appliance. Then we started treatment with SLX 3D. We used a standard prescription, with a 12-degree inclination. Thanks to the precision of the slot on these brackets, we achieved 2 important objectives for this case. First, we were able to maintain the inclination and torque in the process of retracting the teeth. And second, we could close the space between the canines very precisely, with the crown and the root moving together. Other brackets we've tested have oversized slots that sacrifice precision. Using a different system, we would have probably ended up inclining these teeth. SLX 3D's precise slot dimensions minimize play in slot. This helps us to get a faster finishing. This is what we achieved for Antonio after just 13 months of treatment, thanks to the precision and control possible with SLX 3D. 5 months after finishing the treatment, his smile was stable, and I have no doubt it will continue like this in the long term. Take a look at the before and after comparison. You can pause the video if you need more time to appreciate the differences. If for Antonio the primary concern was functional, in Raul's case it was mainly an aesthetic issue. Since we saw his teeth, we knew it was going to be easy and quick to fix his aesthetic concerns with SLX 3D, so we got to convince him to do a slightly longer treatment to correct his bite as well. As you can see in the picture, on the right side he had a Class 3 molar and Class 1 canine, and on the left side he had a Class 1 molar and Class 2 canine. This might seem a complicated case, but thanks to the precise slot of SLX 3D, we achieved the rotations we needed quickly and perfectly expressed. So in just 3 months, Raul saw how his teeth moved a lot, and he was already very happy with his smile. He was also over the fear of pain, because the wires worked slowly and precisely, and he didn't really experience any discomfort. Due to the rounded shape of SLX 3D, the brackets didn't cause friction on the lip over those 2 front teeth that were protruded. Then we continued treatment for only another 5 months to finish the wire progression sequence and detail the case. And we achieved the final result in 8 months with the standard 3 wires progression for SLX 3D. and just 3 in-person appointments. This last case was a complex one, and it was treated in collaboration with 2 other clinicians, a surgeon and an expert in aesthetics. Even if Lorna already had orthodontic treatment as a child, her mandible grew after, and now she had both aesthetic and functional issues that she wanted to solve. At the time, she was studying abroad, so we needed to figure out the most efficient treatment that required the fewest number of appointments. The main goal was to create enough space for the surgeon to insert the scalpel between the lateral incisors and canines to expand the palate, specifically in this highlighted area. The individualized size of the brackets allowed us to get very precise movement expression from each tooth. With the surgery schedule, the clock was ticking. We started with the N2 wire to be able to separate the roots quickly. And on month 11 we had already created that space we were looking for. After the surgery, given the precision of the SLX 3D brackets, we were very confident about how her teeth were going to move next. So we scanned her teeth, and the aesthetic dentist started work on her veneers, the final step in the process. Planning around the surgery would have been very difficult for me without the precision I could achieve with SLX 3D and the M-series wires. Despite the difficulties, I'm very happy about how we managed to fix all the functional and aesthetic issues in just 12 months. As you can see in these cases, SLX 3D brackets are a versatile and powerful clinical tool. To get these results, it all starts with the correct placement, so let's review how to do that. You will have to use the right bracket for each tooth. These colored dots on the brackets will help you identify them easily. The Easy Twist tool protects the doors when opening them. And remember, be sure not to try to use tools for other brackets on the SLX 3D as they can break the doors. And the last step, once the brackets are placed correctly, the wire will sit slightly above the center of the crown. I hope these tips help you offer better and faster results to your patients using the Carriere SLX 3D brackets. I can't wait to see the amazing smiles you will achieve for them.